a wonderful introduction about myself. And I thank you for Dr. Choi and to give me the opportunity to come back to Kuala Lumpur again. Okay, I used to come to Malaysia quite often. Actually, we started a stem cell company back about 15, maybe even 18 years ago in Penang. Okay, that was I used to come to Malaysia quite often in Penang. But lately, because of COVID-19, so I have not been back in Malaysia for the past several years. And I'm very happy to have the opportunity to come back to Kuala Lumpur again. So anyway, let me start telling you about what we know about anti-aging. Okay, and before the talk, it's very interesting that I got into a conversation through the introductory of Dr. Cho to meet a couple doctors here in Kuala Lumpur. And I think during this talk, we're going to have a lot of connections, and we can share a lot of our experience about anti-aging. So before I get into my talk, I just want to tell you a little bit about my background, and on top of what I said, Roger, right, who just said about me. Okay, I think the only and interesting thing you need to know is this: I'm a surgeon. Okay, I cut people open and make people more younger and more beautiful. That's my job, clinical job. But the interesting part is I'm also a chemist. I'm a physical chemist. Okay, so my PhD is we study the astrophysics. We study what happened in the universe, the beginning of life, and a lot of things like that. So what I'm trying to tell you here is not just from the perspective of an scientist, nor just from the perspective of as a physician. Okay, I'm trying to share you that how am I as a chemist, and how can I interpret and try to resolve the problem of aging. Okay? So this maybe you can get a different viewpoint in terms of the anti-aging. So this is the outline of my talk. The first thing I tell you a little bit is about a brief introductory about the heterochronic parabiosis. And after that, I tell you, go into some mechanism, which was totally boring. We're going to skip it as soon as possible. And after that, I'm going to tell you a little bit about stem cells. Okay? So, and I will tell you the inside story about stem cells. I mean, you all hear about stem cells. And I know a lot of doctors has been using stem cells now, right? I started using stem cells, let me tell you, okay? Exactly today, 30 years ago, 1994, back in University of Pennsylvania, Children's Hospital of Philadelphia. That's how we started using stem cells. So we have a bit different experience now from the surgical standpoint or from the chemical standpoint in terms of all these technologies. And after that, then I tell you some advances in the basic science, okay? So what I'm trying to tell you is the anti-aging technology right now is probably beyond most of people think now. We have a lot more understanding about stem cells, and we also have a lot of understanding about how to use the stem cells properly, okay? That's the key. And in the end of it, I'm going to show you some clinical example, and some of you maybe find it interesting, and some of you maybe find it boring, and I'll finish my talk with an conclusion. So most of you probably heard many talks about anti-aging. And the truth of the matter is, why is that people want to anti-aging? It's very simple, okay? Because aging causes a lot of problems, okay? So aging make you look older, make you feel less energetic, okay? And make it can cause a lot of disease, and a lot of these disease, you probably think you know about it now, but you will be surprised to know 20 years ago, okay, it's very, very rarely you can hear this disease. I can give you one example. We talk about a very common disease. People talk about osteoporosis, right? Okay. So say like 40 years ago, the average lifespan is 65. Okay. So people work until they retire, they get on the cruise ship, and they die, right? That's the old days, right? So for the ladies who had their menopause, after they're probably 15 years after menopause, they die. So you don't really see that much of a serious osteoporosis problem. But nowadays, all the ladies are living up to 90s or 100. So you're going to see a lot of new problems keep on coming up. And this list is just a partial list. And you're going to see the list gets longer and longer as the lifespan of the human continue to extend. Okay? So the key is, the older you get, the more problem you're going to get. So the more disease you're going to get. However, people still trying to extend this unhealthy life longer with the modern medical technologies. And that's the reason we need to work on it. The key is not increasing the lifespan. The key is increasing the health span. Okay? So the best life is you live very happily and actively, looking good, and you finish as quick as possible if you have to finish. Right? So that's the reason people are interested in anti-aging. So aging causes a lot of disease, make life miserable. So people begin to think, if I can stop aging, then maybe I can have a lot of, I can avoid a lot of the agonies in the aging. Okay. So now, so it's no reason about talking about anti-aging. Nobody wants to get old. To the best of my knowledge, I don't know. If you want to get old, maybe you can leave now. I don't know. Okay. So now let us look at this. What's the problem with anti-aging? You know, a lot of us, like me, okay, myself, I started teaching anti-aging medicine as the first lecturer in the major academic university who teach anti-aging medicine. That was back in 1994, 30 years ago. Okay, and the reason I got into this anti-aging sort of topic is not by choice. Why is that not by choice? Because at that time, people in America begin to see the coming tsunami of the aging, right? So the dean of the medical school of UPenn, University of Pennsylvania, where I work, sent a note to all the department heads, say, you need to have someone in the department begin to pay attention to the anti-aging issues. So I belong to the plastic and reconstructive surgery division, right? So the dean, the chief of our section is called Linton Whitaker, very famous craniofacial surgeon. And so we have this morning meeting, and Dr. Whitaker just look at us and say, hey, somebody has to teach anti-aging medicine. Right? Is anyone of you want to do it? Think about it. I'm a surgeon, right? I like to cut. I want to move. I don't like something silent, not studying and this and that. So nobody answers, right? No surgeons want to get involved in anti-aging medicine, okay? Because we are trained to do surgeries, not trained to study medicine. So Dr. Whitaker has no choice. So he look at me and say, hey, Fushih, that's me, right? I'm the most junior guy in the faculty, right? He said, you're the youngest guy, so you go and participate in this project. So that's how I get into anti-aging, okay? But that's a nightmare. You know why is anti-aging is a nightmare in medicine? Because traditional medicine, Western medicine, okay, believes in one disease, one treatment, okay? So basically, you have a disease, you have a diabetics, so you go and treat diabetics. You have a fracture of the bone, you go and treat the bone fracture. And just like Dr. Tsai, I'm going to pronounce my way, so don't get offended, okay? This is Dr. Tsai, okay? I had just learned this line from him. He said, doctors only worry, none of the doctors worry about healing process, right? Okay, healing is very important. You can do the surgery if you know healing is it means nothing. Okay, so anyway, so anti-aging medicine, the number one problem is violating the fundamental principle of the Western medicine. So even to this date, a lot of the classic, academic doctors, they still think this anti-aging medicine is voodoo. But I'm going to try to convince you during this talk, it's not a voodoo, it's a science. It's beyond medicine. Medicine is a practice of art and science. But the practice of anti-aging medicine now, because we already have so much data, it's not becoming like a scientific issues, okay? The second problem of aging is this, okay? Because aging is like a lion. It's so powerful, causes so much problem. But everybody look at this aging problem from different angles. So the internists look at the anti-aging like a lion from the front view, but the surgeons look at it from the other aspect. So they have totally different interpretations. And to this date, I think it's fair to say, I think most of people still don't know what is aging. Okay, people talk about it without realizing that we really don't know much about it. Okay, so let me tell you something which is reliable in anti-aging to this day. The number one, if you want to fight against age, these are the formulas. The top three are free. I'm going to giving you out to you all free. Okay, the number one thing is we call it stress management. So you need to have the correct mindset. That's the number one issue, in my opinion. So all of you sitting in this room, I think all of you have the correct mindset. And I look at, I'm a plastic surgeon, trust me, okay? I do a lot of surgeries. I can look at people just as in half a second, I can see a lot of things. That's my training, okay? I see a lot of people who is very, has a positive attitude in this room, okay? That's the reason you are here, anyway. So the second thing is diet. So if you have the positive attitude, and if you can diet, you can manage, somehow one way or another control your diet, then you have a way to fight against aging, okay? But like what I just told one of the patient I consulted this morning, because it's just like everything else, in medicine, almost everything has a good part and also has a bad part and has an ugly part. So if you are doing something like a diet, 168 or twice a week, 24 hours, starvation, things like that, then you need to make sure that that doesn't mean that you're going to stay healthy, okay? That's just giving you one way of managing part of the aging problem, and you still need to be worried about the side effect of that. And the third one is the exercise, and I'm sure everybody knows about this now. But I want all of you to think one thing, okay? I started going to gym back in Taiwan, 2003, okay? That's about 21 years ago, right? So when I joined the gym, I have to spend about $2,500 US to participate in the gym. Most of the people tell me that you're crazy. Why are you spending so much money on the gym? But now look at the business of the gym now. Everybody go to the gym now, right? So I'm sure similar things is going to happen about what we are talking about today. In the future, when we look back, I'm sure you will be surprised about what we are talking about today. It's going to become the mainstream of the anti-aging. So the three things I just told you about, one is the stress management, the mindset. Number two is the diet. The number three is the exercise. All those three, you can pretty much do it for free, okay? The problem of these three methods is that all of these methods are free, but very hard to continue, right? And it takes time. So let me tell you one thing, and you need to think, okay? Because it's your body, it's your health, okay? You need to think. You are the one who's going to make the decision. The number one problem of anti-aging method is it takes a long time for it to happen. So it takes time for you to do anti-aging. So it takes you 3 years to become younger, right? But the problem is that when you become younger, you are 3 years older already, right? It doesn't make any sense. It's a dilemma. Well, you keep on getting older without seeing you getting younger. So in America, you get to see a lot of people, okay? It's like this. These ladies, they started jogging when they are probably in the 18s, right? They keep on jogging until they become old and fat. So this is anti-aging, okay? Because it takes time. The effect of anti-aging is too slow that you cannot reverse it. You cannot see the reverse of it. So what we as a medical scientist is trying to invent or try to understand the aging so we can come up with something which is more practical in terms of fighting the aging. So this comes to me as a coincidence. This was back in 2012 when I participated in the global competition of the entrepreneurship competition of University of Chicago. Okay. So anyway, to cut it short is that at that time, just by coincidence, I was bring to the attention that there was a technology invented by a University of Chicago alumni called Alexis Carrel. Okay, Alexis Carrel, he won the Nobel Prize back in 1912. He's the Nobel Prize winner of 1912. So what he was doing is this technology called Heterochronic Parabiosis. It's composed of 4 Latin syllables. So the first one, hetero, means different. Chronic means time. Okay? Para means next to each other. And the biosis means to live. So what it says that means heterochronic parabiosis sounds pretty knowledgeable or something fancy, but it's not. Basically, what it says that you just connect 2 persons, old and young, connecting them together. Or you can say, let the old people and the young people to live together. That's the way it is. The interesting part of this experiment is that the way to do it is you pick an old mice, and you also find a young mice, and you stitch their skin together. In about 5 weeks, you can see the old mice become younger, and the young mice become older. Okay, you probably think it's funny, but this is, to be honest, to this date, this is the only line you need to remember. Okay, heterochronic parabiosis is the only aging reversal method that is rapid, that's fast enough, and you can see it. Okay, the problem is what? This can be only done on the mice, cannot be done on the human. Okay, so do you know, any one of you knows how can you connect an old person with a young person? How can you connect an old person to a young person? You can look to somebody next to you, right? If he's younger, you can ask him, well, do you want to connect to me? We'll come up with an answer, okay? So the technology this is the history, and we need to honor that. It was started in 1864. So somebody tell me, today you're talking about a new technology. I say, no, I'm talking about very old technology, okay? We're talking about the new interpretation of the oldest anti-aging technology, okay? So, and back this is Carrel's 1906, and 1957, this is Clive McKay. So people nowadays, they say, especially the doctors inside, they always say, what is the underlying mechanism? Otherwise, voodoo, right? So, like Dr. Esther, if you give somebody a medicine, you're going to say, oh, this medicine is going to act as some receptor and this and that. So In 2005, this is almost 1 century after the beginning of this experiment, connecting the old and young, and to make the old animal younger. Okay, the mechanism was understood, and this study was done by Dr. Randall of the Stanford University, and these are all the pathways. If you are interested, you can see it. So after Randall did the experiment, proven that the connecting old and young to make the old mice younger is not voodoo. It does has a scientific basis. So this make the hope of fighting the aging, the idea become resurrected. Okay. So and after that, this is the study on the liver, study on the heart, on the brain. Like Dr. Tsai, you're doing something related to this, right? And on the immune, that was the previous study. This is the rejuvenation of the arteries, which is the key to aging, right? The aging starts with the blood vessels and to the kidney, okay? So what I'm trying to tell you so far is connecting to a young person or connect to a young animal can make you younger. The problem is, how can you do it? And that's what I've been working on for the past 10 years. So the first answer, yes, you can do it, okay? So all the ladies in this room, I have a good news for you, okay? Getting pregnant is a very good example of the heterochronic parabiosis, okay? So if you have the last child, you have the last pregnancy at age of 45. For example, if you have pregnancy at age of 45, as compared to have the last pregnancy at age of 35, okay? So if you get pregnant at a later part of your life, the chance of you to live to 80 years old is 50% higher, okay? So all the ladies who still can get pregnant, and you can pretty much finish without listening to my talk now. Repeat. all the ladies in this room who still can get pregnant, okay? And you have the best way to do anti-aging, right? Because you can just go home and wait until you're 45 or 50 and get pregnant. And you can get the effect of anti-aging, okay? Let me ask you one thing. What is the easiest way for men to live longer? We start from here. Do you mind? Ferrari, that's good guess, yeah. That comes both ways, right? Now, what's the best way to live longer for men? Become a woman, right? Think about it. The woman has lived 10% longer than men, right? Think about it. If for all the men here, think. No, don't. You need to think like a scientist, like me. Okay, think. If you want to live longer, you want to have your lifespan from like 75 to 85. The easiest way, become a woman, right? Anyway, so the easiest way is get pregnant. Then you can get the effect of the heterochronic parabiosis. Now, but the problem is that the first thing is that you cannot connect two people together, and men cannot get pregnant. So this is a very popular news now on the news that it's a rich guy in the States, okay? So because he cannot get pregnant, right? So he tried to get the young blood, the effect of heterochronic parabiosis, because I'm sure his son don't want to connect to him, right? So instead, he can only say, hey, I will buy you an iPhone, right? So please give me your blood, right? That's basically what they do, okay? No, Americans are creepy, especially rich people, He looks a bit jaundiced. Well, I don't know the guy. Maybe when I see him, I'll tell you. So, since men cannot except pregnancy, you cannot connect to young people, right? And you cannot easily get young blood, right? So that's the reason we try to develop a technology to make the old blood younger. So this don't apply to you. I was surprised about what you are telling me about the Glen Eagle. You can get young blood, right? Yeah. So here are two parts in the blood. So our challenge is try to make the blood in my body become younger. That's basically the challenge, right? So the blood has two parts. One is the cellular part. That means that the part of the blood has like a red blood cell, white blood cell, and things like that. And the technology coming out of that part from the cell-based part is what you call the stem cell technology. And you probably heard about it. And let me summarize everything about stem cell technology to you here. So if you are talking about injecting MSC, that is the most popular one. Then you have two sources. One is from yourself, autologous, from your own fat, or from another people, mostly from the umbilical cord, right? So the age of the MSC from your body, it should be older, right? And from the cord will be younger. And the function of the older stem cell is poorer, but it's safer because it's from your own. But the cell from the young other people's cord, the function is better, but because it's from another person, you always have the risk of getting rejection or some graft versus host disease. And on top of that is different matter of opinion, and we can talk about this on and on, okay? Let me tell you the issues about the stem cell therapy. I have been doing this for 30 years, so I think I can share with you about stem cell therapy. The number one sentence, and probably the sentence you really need to know is, stem cell is just a tool. It's a tool. It's just like a medicine, right? Or a chair or a computer. It really depends on how do you use it. If you don't use it correctly, it's useless, right? So now I want to tell you this. We can discuss about it. My experience of using stem cell for 30 years, stem cell is locally effective. That's the key. Okay? If you doing what I'm trying to tell you is that if you infuse the stem cell into the vein, not in the epidural space, okay, into the vein, the first problem is all those stem cells you bought, right, from the lab, and the technicians culturally, very carefully, and things like that, can they survive? That's the number one question people has not answered. Okay? The number one issue is, if the stem cell can survive your bloodstream, by anatomy, they will go back to the right heart first, then go to the lung, right? So in the lung, they are going to encounter a very narrow passage of pulmonary capillary. That's about 8 micron in diameter. So if the stem cell, the size of the stem cell is more than 10 or 15 micron, cannot pass, okay? So all those stem cells you infuse in the vein, eventually 95% of them is going to your lung. So if you have a problem with your lung, you can infuse the stem cells, okay? The next question is, if the stem cells, the survival rate of the stem cell in the blood is low, then the stem cell, after you infuse it, is going to be acting as a plug of the capillary in the body. When you're doing anesthesia, you're going to see this, like a PE. Yeah, you're going to see this. So the dead stem cells can actually do some harm by a mechanism called reperfusion injuries. Okay, so these are the three issues. This is not a problem of the stem cell company. This is the problem of doctors who use stem cells. They need to address these three issues. It can be solved. It's not like don't worry about it. It can be solved, but we are 30, 40 years out of the original stem cell therapy. You just infuse as many stem cells into your vein and keep your finger crossed, hoping for the best. That's old days, okay? Nowadays, when we infuse stem cell, You need to be able to address these issues to make the stem cell therapy effective. Okay? And you can call me on this, okay? This is very important. These are the problems that doctors need to solve it. The question is, how do you solve this problem? How can you make the survival rate of the stem cell in the blood higher? The higher the better, right? So you spend your money to buy the stem cell. You don't want them to all die, right? Yeah. So the answer lies in the cell-free part of the blood. We'll come back to the blood, okay? So to make the blood younger has two parts. One is the cell base, right? We just talked to you about stem cell therapy. Now we talk about the part which has no cells, which you call the plasma, or you call the cerebellum and things like that, right? Again, we all stand on the shoulder of giants. Nothing we are doing is really that new. People already done it for 100 years, okay? So this is start with La Prairie, right? People go to Switzerland to get the injection of the extract from the lamb, fetal lamb. This is the very early attempts of doing the stem cell therapy. Okay, it's from a xenographic source, from the lamb, right? So I'm sure you heard about these things, and you probably also know, back in 1970s, the Japanese already begin able to create something called placenta extracts from the donated human plasma. So these are the cell-free, very early attempts about how to make the cell-free part of the blood younger, okay? So the new data come out in the past about 10 years ago now, 8 years ago, okay? So these are new studies tell us the blood plasma has two problems, okay? The first thing is that it's begin to be short of young material. The other thing is the old plasma has too much bad old materials. So the concept is not new again. So Corral, this is the sentence of everything. I really suggest you, if you have a cell phone, take a picture of this. Everything we did is based on this, okay? I mean, this is not my credit, okay? It is Alexis Corral, the guy who started the experiment 110 years ago. He already said this, okay? So what he's doing is he get a heart of the chicken and put it on a petri dish. And every couple of days, he exchanged the fluid. He take out the bad old fluid and put in the new fluid. Take out the old fluid and put in the new fluid. By doing that, he can keep the heart of the chicken continue to work for 20-some years, okay? So this is the true anti-aging, right? Anti-aging, so this is done, okay? So this was done, right, for 34 years, right? Back in 1950s. The problem is, how can you do it in a clinical setting? How can we do it on you to make you live longer and healthier, right? So after the, around 10 years ago, this is the doctor in San Francisco. He's from Yugoslavia, okay? So he's an expert in doing this continuous plasma dialysis. So some people also ask me about this. This is called therapeutic plasmapheresis. That's the official name. So you can use this machine to remove the old and like the cholesterol material, some of the bad fatty material, things like that. And in Chinese, we call it 血液净化, means you clean the blood, okay? So cleaning the blood, is it effective? Yes, it can remove the extra lipid, the cholesterol, things like that for you. The problem is it will last only about 2 weeks, okay? And on top of that, other than that, you can really see some anti-aging effect of this technology, okay? And it's also been used for the treatment of Alzheimer's disease. So the clinical trial came out like this, okay? You can see, this is the time, right? Oops. And the y-axis is the MMSE, is a cognitive scale of the Alzheimer's patients. So if you don't use this technology, then the MMSE score can drop very quickly. But if you continuously to do the plasmapheresis on these patients, the rate of deterioration can decrease by 70%. So this is a big change for the Alzheimer's patient. In our experience, if the patient, after they went through a couple of sessions of the plasma exchange, the MMSE score can go up by about 3 points, usually. That's what we usually see, out of the 15, okay? The problem of the plasma pheresis is this. Did you see the triangle here? You see the triangle here, right? Each triangle means one therapy. So the problem is not whether it's effective or not, is because you need to do so many sessions. You need to do about 20 or 25 sessions of the whole body plasma wash, okay, in about 6 months. So most of the time you're going to require a central line to do this, okay, and which is not practical, okay. So we try to look for something more practical. I think this is a good time for me to share with you what we know about this, okay. These are the 2 keywords about how to make the blood younger. Let me say again, right? How to make the blood younger. How means a method, right? The key word is what? Blood, you know, right? The key word is younger. So the first question come to us is, what do you mean by younger? So what I'm trying to tell you is this. If we don't have a benchmark to measure the age of the blood, then it's pretty much useless. It's all by our subjective explanation of what's happening. So this is like this. Assuming these are all my friends in Taiwan, right? So we have having dinner. So assuming these are their blood, right? And we're confused about which one is from which one. And can you tell me which blood is younger? That's the hard one. That's the hardest question, okay? When people talk about, I make you younger, but can you tell me what is younger? How do you measure younger, okay? For the cell-based, you can do it. You can measure the length of telomere or measure the DNA methylation in the cells. But for the plasma, how can you measure the age of the blood? So what we do is this. Because I started doing experiment when I was 7 years old, I need to help my father to do some bacterial culture in the lab. And I think if you ever work in the lab, you know, if you want to do a cell culture, you need to use the blood of what? Of a fetal cow, right? Or the fetus of a cow. If you use the blood or the plasma of an old cow, it doesn't grow, okay? So this is the idea we get that based on this observation, the younger the blood, the faster the cell can grow. Does that make sense? Okay, that's the definition of whether the blood is younger or older. And if you have better explanation, you can tell me, and then we can work on it. Okay. So by that we set up a benchmark. So this is the human plasma. Then this is the fetal blood from the cow. So we compare them using this one as the relative scale. We compare the activity of your blood with the blood of a fetus. Okay. So the higher the activity, so the younger your blood gets. So with this concept, we begin to did about 3 years of experiment using the MSC. And then eventually we find out one thing is the blood plasma, if you're using the plasma to culture the MSC, which actually lives outside of the blood vessel, is probably less sensitive. So recently, since about 1 year ago, we switched the test cell to become EPC. You call endothelial progenitor cells. That's the cell which is responsible for repair the blood vessels. And we are able to test the age of the blood using this type of technology. The next one is after you have the benchmark to measure the blood, whether the blood is young or old, then you need to come up with a way to make the blood younger, right? So the formulation, these are the typical formulation. And of course, all the doctors knows about this composition. But what happened is, this is really based on the work of Tony Whisker in Stanford. He published a paper in 2019. So what he does is this. He analyzed 7,000 protein of the people aged from 19 to 90 and compare about the total cohort is about 3,000 patients. And by analyzing this, he was able to separate all the proteins, all the components of the plasma into 8 categories, okay? So you can see the first category is act like a parabolic increase. This one goes flat, then later on in life it increases. And this one stays same throughout the life. This one goes down, and this one goes down with life. So this is, we call it cluster 1 through 8 of the protein in the blood, okay? So with this analysis, can you make the blood younger? If you're a chemist, you probably think you will, right? Here is about 1,500 proteins. So it's just like you're cooking a sauce, right? Then you have 1,500 different spices. How it's going to be difficult to cook a dish without many spices, okay? So still the question remains, okay? So the answer is this. Category 1, 2, 3, 4, 6, 7 increase with age. And the category 5 and 8 decrease with age. So if you want to composite it chemically, it's too complicated, it cannot be done. So this is the idea we come up from a chemistry lab. So what we do is this. You don't need to look at the slide now, okay? What we do is this. Because I'm a chemist, right? So how can I make it younger? So we have 8 different types of proteins in the plasma. So the first thing, we draw the blood out. We take out, say, 300 cc of blood, right? So by taking the blood out, all the proteins in the blood decrease by 10%, right? Everything out. 1, 2, 3, 4, 5, 6, 7, 8, everything out. And after you take them out, all what you need to do is just, you need to supplement those proteins decrease with age. So you simplified the number of the protein you need to compound from 1,500 to about 200. We'll make it a lot easier, okay? So then we further analyze the proteins in the cluster 5 and 8. So for the cluster 5, these are mostly growth factors and something related to the delivery of growth factors. And for the cluster 8, it's mostly related to the receptor of the growth factors. And by doing this, so we pretty much, we have a formula. Basically what I'm saying is we can draw the blood for a couple hundred cc. And if we can find the soup, which is made of cluster 5 and 8, then bingo, we should have a formula to make the blood younger. And we should have the way to duplicate heterochronic parabiosis in the human body, right? Does that make sense? Okay. So the number 5 and 8 is very difficult, okay? Because these factors only exist in the young blood. So this comes to the line, you probably want to read this, okay? Inside every adult, there's still a child that lingers, right? Inside every adult, there is still a child that lingers. So what our finding is very simple, is In the old people, they still has young proteins. The difference is that those proteins are usually confined in the platelet and in the exosomes. So with that understanding, so all what we need to do is extract, we can take 300 cl of blood from you, right? And then we isolate the growth factor 5, category 5 and category 8 in the lab from your blood and give it back to you. Does that make sense? With this technology, you can say that this is a new way of precision personalized PRP, if you want to understand it. You can go ahead. Yeah, you can go ahead. So you still need to do it repetitively. Okay. So this is just like what I told you. For men to become a woman, to live longer, become a woman, right? So you need to do two things for men to become a woman. What are the two things? The first one, you need to have menstruation, right? The second thing, you need to have get pregnant, right? That's the only two things the man cannot do as compared to women, right? So you can take out the blood, then we process it, take out the young material, and give it back to you. That's what we do, okay? So this is just an explanation of that. And this is a production scheme. This is the ELISA data of all the growth factor 5 and 8 in the blood. Then comes the new question, okay? And I think all the doctors know, right? The growth factor, even after we are able to isolate the factors that can make you younger, the half-life of these growth factors too short, only minutes to hours. So in other words, if you want to do this, using this technology up to this stage, you need to come back to the clinic, come back to T-Docs twice a week for an injection to keep the effect going. So because we are chemists, I have a couple of patents. So we have a patent, we can extend the half-life of the growth factors, of these valuable growth factor to about 3 weeks. So as a result, we come up with a formulation. You can come back every like 2 to 3 weeks to get an injection and can keep you going, okay? So then people begin to ask me, so how long do I need to continue to infuse this? Okay? It's really not that long because based on the effect of the pregnancy on longevity, what we need to do is we need to maintain the plasma activity high enough for only about 3 months, okay? You don't need to keep on going, that's too strong. You just need to increase the activity for 3 months to simulate the beneficial effect of the pregnancy, the young blood from the fetus on the mother. Okay, that's how we do it. So these are some of the examples. So we do this test on every patient. So this is after the first treatment, it becomes younger. And after younger, then the effect can last for about 10 weeks. It still remains the same. Then he can do another session. So in other words, he got some 3 sessions, have some improvements. Then he got the next sessions, it go all the way up 120 times. Not to use stem cell, just using the plasma is not. I'm trying to tell you is, if you want to inject stem cells, you need to do it intelligently, not just the old way, just get a lot of them, just and keep your finger crossed that it's going to work. No, it's not like that. So with this technology now, we can predict how many stem cells is going to stay in your after we infuse it. Okay, so you don't need to infuse so much stem cells. Okay, so that's basically the take-home message. And these are some of the cases. That's for stroke patient. These are for diabetes. The HbA1c dropped from 16 to 6. Okay, and these are the effects for the kidney. Somebody has a kidney problem. Yeah, normally after the couple sessions, the eGFR can be improved by about 15%, 15%. Okay, and this is our data, more data on this. So if you don't, this is the natural progression of the kidney disease. And after do some infusion, the eGFR, we can hold it, and many more cases. So anyway, let me still begin to come into the last part of the talk. I begin to summarize what I have told you. Okay, if you cannot follow logic, it's fine. We can discuss about it after the talk, but try to understand this. So these are the old proteins. These are the young proteins. So what we are doing, the first thing is that you take out some blood to reduce the good protein and the bad protein. Then on top of that, you begin to adding some new cluster 5 and 8 growth factors into that, so that can make it younger. And at the end, you can add in the stem cell. It's almost like cooking, right? You put oil into it, then you cook or something, then you add in this and do that, and after that you harvest it. So the traditional, this is the old stem cell therapy. So you have an indication, somebody wants to younger, so you just buy the stem cell and infuse it without knowing the survival rate, without knowing where the stem cell is going, without knowing the risk of the stem cell infusion. So by what we are doing now, by doing some extra test before the stem cell infusion, you have the DM in the green DM in your seed. By doing this test ahead of time, you can use less stem cell, more effective and less harmful. Okay, that's what we can do. And it gets complicated now. The new technology is begin to become this. The practice scheme is like this type of schema now. Yeah. So on the average, after you do one session of the plasma conditioning, the activity of the EPC can be increased by about 95%. Okay, this is our experience, and so these are the effect of this type of treatment. I think I'm running out of battery. Let me change. Oops. Oh, okay. 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 So these are the effect of the heterochronic parabiosis. Make you you can read it more energetic. You can lower the chronic inflammation, improve the sleep, improve the kidney function, lower the risk for cardiovascular disease, and things like that. And these are the subjective findings. Means that the patient can feel like this. And these are the objective findings. Basically, if you do a blood test, you can see the decrease in the hsCRP, decrease in HbA1c, now improvement in EGFR and things like that. These are all become standard now. And you also need to know is the complications of this type of therapy is you can have an allergy reaction, like a skin rash. And some people become so energetic they cannot fall asleep. And in Indonesia, for whatever reasons, the men in Indonesia, they tend to have hiccups. After the treatment, they have hiccups. Did you see them in Malaysia? Hiccups. One hiccups, yeah. And some people has an increase in appetite. Okay, and these are the indications. So basically, this program is for people who want to live healthier, want to decrease the risk of the stroke and heart attack, or people who has cancer want to reduce the recurrence rate and reduce the risk of metastasis. So let me summarize this. The indication for what we do, okay, you can forget about everything I told you so far, just remember this. The indication means that who should be considering doing what we are offering. It's very simple. Whoever interested in stem cell therapy. If you ever think about stem cell therapy, or maybe you're skeptical about stem cell therapy, or you tried it before and you don't feel anything, or you tried it before and you feel very good and you want to be even better, you need to consider what we do. It will not only make it more effective, will also make it safer for you, okay? And it was also cheaper for you. So the future, we'll be developing more formulas, and we're doing the dynamics of the therapy. We're developing some pharmaceutical agents. And these are a short video in Chinese, just in case some of you here is not comfortable with Chinese. So that's pretty much it. Yeah. So I think this is pretty much the end of my talk, and I'll be happy to entertain any questions if you have any. Thank you.